after bariatric surgery. First, what is this? We have to talk about the definition. Bariatric surgery is the most effective method of achieve sustained weight loss. It is increasingly performed in women of reproductive age. Some studies have shown that women who have undergone bariatric surgery have a higher risk of preterm birth than women who have the same body mass index (BMI) and have not undergone bariatric surgery. Now a video explaining.
Children of women who have been treated with bariatric surgery are more likely to be born prematurely and be small in size for their gestational age, compared to other babies who were born to women who had not received weight loss surgery. Investigators from the Karolinska Institute in Sweden claim that their findings demonstrate that pregnancies for women who have undergone weight loss surgery should be regarded as high-risk pregnancies, and that these women should receive more attention in their prenatal care. For this study, researchers examined data concerning 2,500 babies who were born between the years of 1992 and 2009. All of these infants were born to women who had undergone bariatric surgery. They were compared with 12,500 babies of mothers who had not received weight loss surgery. The study findings revealed that 5.2% of infants born to women who received weight loss surgery were small for their gestational age, compared with 3% of babies who were born to mothers who did not undergo the procedure. It was also found that 4.2% of babies born to mothers who underwent bariatric surgery were large for their gestational age.
Now, method. We previously reported outcome of pregnancy in 590 women with a history of bariatric surgery who have birth between 2006 and 2011, as compared with women matched from pre-surgery BMI, and we found no significant association with preterm birth. We now report the risk of preterm birth among an expanded cohort of women who have birthed between 2006 and 2013. How I do it?
Your surgeon will perform bariatric surgery if your weight loss efforts through lifestyle changes and medications have been unsuccessful. There are two types of bariatric surgery. Restrictive procedures decrease the size of the stomach so a person feels full quickly. After surgery, the stomach holds about 1 cup of food. A normal stomach holds 4 to 6 cups. Malabsorptive procedures decrease the absorption of calories in the small intestine. Before your procedure, an intravenous line will be started. Bariatric surgery requires general anesthesia, which puts you to sleep for the duration of the procedure. A breathing tube will be inserted through your mouth and into your windpipe to help you breathe during the operation. Gastric bypass, technically referred to as Roux-en-Y gastric bypass, is both a restrictive and malabsorptive procedure because it reduces the size of the stomach and decreases absorption of calories in the small intestine. Your surgeon would use one of two methods for gastric bypass surgery. The open method requires an 8 to 10 inches incision in the abdomen. The laparoscopic method only requires several small keyhole incisions, through which your surgeon will pass a laparoscope and surgical tools. A laparoscope is a thin lighted instrument that projects images of the surgery on a monitor in the operating room. During a Roux-en-Y gastric bypass procedure, your surgeon would use surgical staples to create a small compartment, which will serve as your new stomach. This pouch will hold.
Now, risk. What is the risk of doing this procedure? As with any major surgery, gastric bypass and other weight loss surgeries pose potential health risks both in the short term and long term. Risks associated with the surgical procedure can include excessive bleeding, infection, adverse reactions to anesthesia, lung or breathing problems, leaks in your gastrointestinal system, and inclusive to death.
I'm glad I did it. I don't regret it.
Penny Wheeler loves feeling lighter on her feet and healthy again. Gastric bypass surgery allowed her to hit her targeted goal of weight loss. Penny says her weight began to soar after a successful fight against cancer. At her peak of 330 pounds, all dieting solutions had failed, and doctors gave her a dire warning.
If you don't have the surgery, you will die within a year. And that was an eye-opener right there.
Mayo Clinic gastrointestinal surgeon Dr. Michael Saar performed a Roux-en-Y procedure. He explained to Penny it would decrease the amount she could eat as well as the length of intestine where food is absorbed. He also explained it would not all be smooth sailing.
Like Dr. Saar said, I'll do the surgery, but you have to do everything else afterwards, which I did.
Regular exercise is a must. She also had to make radical changes to how and what she eats. Some changes dictated by her newly sensitive digestive tract.
Milk gets me sick. You know, like I was not lactose intolerant before the surgery, but I am.
Now, type of bariatric surgery. Each type of bariatric surgery has place and sense. Be sure to talk to your doctor about them to choose the better option. Now, Roux-en-Y. This is a type of gastric bypass surgery and is the most common method of gastric bypass. Biliopancreatic diversion with duodenal switch, laparoscopy, adjusted gastric blending, and with gastrectomy. Now, the results. We detect significant higher risk of spontaneous preterm birth, but no medical indication in preterm birth among women who had bariatric surgery than among controls. The results of our analysis of preterm birth were similar when the analysis were restricted to women who were either nulliparous or had a history of preterm birth. Thanks.